Some people may, going through the stage, may say, oh, it was just because it was Vegas and I was shit-faced, right? Or they may say, oh, it was just one time we were just like playing around, haha, it didn't mean anything, right? So you never know. Could that be true? Definitely. I have many parents that call me and say, I want you to work with my kid. I found a text, recent one, I found a text between him and this boy, and I think something's going on, and I want them to know that I'm cool, and he even brought up that he thinks he may be gay, and this, that, and the other, and I just want to know I'm going to be cool with it, and I'm like, slow your roll for a minute, right? You don't know that this is the case. He's exploring normally, right? So he could be, he could not be. Don't push him in a direction that he might not go. And right now, I've been working with them for 6 months. This kid's got like 10 girlfriends, and everything that we've talked about, I don't see it. And so I'm like, just slow, let him go through his stuff. I'll talk to him, I'll work through it, but, he knows you're supportive. So sometimes there's this push because the parents want to be like, yeah, I'm that cool parent that accepts their kid. It's not about you. It's about the kid or whoever it is. So what do we do in this stage? One of the things that you want to do is explore the internal positives and negatives. So I would say, what would it mean? Like, what's the positives if you were gay or lesbian? What does that mean to you? Well, I found an identity. I finally figured out why I feel different, this, that, and the other. What are the negatives? I'll be kicked out of my church. My parents will disown me, and yada, yada, yada. And it's like, okay, now you have a lot of substance to work with. You know where it might become an issue. You also know the positives that you could use as a strength to help them through it, right? The other piece is to educate about the continuum. So imagine that 0 to 10, 0 being completely heterosexual, 10 being completely gay or lesbian, 5 being bisexual. Imagine that continuum. Nobody is a complete 0 or 10. When I do this training, I say, okay, put me on there. Where do you think I am? And if you say 15, I'll hurt you. Somebody did that once. And I'm like, really? So I would identify as a 7 because I still am attracted to males. Would I prefer to be with a male? Yes, because women are a pain in the ass. But I meet all these wonderful guys, and I'm like, oh my God. Like, how does this happen? And then I have my girlfriends that are like, men suck, I can't find a good man. I'm like, I never had a problem finding a good guy. Anyway, so everybody fits, even if it's a 1. I mean, somebody may look at, a guy may look at Ryan Gosling and be like, oh my God, he's very attractive. Not that he'd engage in any activity with him, but he's attractive. At least I think. Vin Diesel's my favorite, though. That's probably the one guy that could turn myself around. So I'm educating them on the continuum, right? Now I'm thinking of Shamar Moore. Have you ever seen him in that show? Not NCIS.
Criminal Minds.
Yeah, Criminal Minds. Oh my God. Yeah. Okay, going back. See? A 7. I might have just went down to 5. But so normalizing the sexual development, normalizing exploration and all of that fun stuff so that they can see, okay, I'm okay. I'm just seeing if these things exist. Okay. I need one of these. Stage 2, identity comparison. This is where the person's saying, maybe this does apply to me, right? But if you notice, I say possibility here. The individual begins to accept a possibility, because in the future we're going to talk about probability, okay? So in stage 2, the individual begins to accept the possibility that they may identify as LGBT, etc., etc., etc. Now, what happens is, well, tell me what you think self-alienation might look like. If somebody self-alienates, what does that look like?
Not being on their phone.
Not being on their phone?
Not picking up their phone.
Oh.
Not going out with their friends as much, isolating.
Yes. And you said?
Just hanging out with this, like, who they're supposed to be attracted with, not wanting to hang out
Yes.
with other genders.
Yes, that could happen as well. So they isolate. Why do you think they isolate? Why do you think they pull back from hanging out with people or talking or whatnot?
You don't identify either.
Yes.
Limit rejection.
Yes. I don't want people to see me because it's kind of like when you were in high school, and you may still have it, and you get this tiny little zit, right? And to you in high school, it was like yay big, right? So you're like, everybody sees this. That's what people think. Everybody's gonna know what I'm thinking. It's kind of like a bad high, you know? I only know that from like ages 21 and 25, but where it's like, everybody's looking at me like they know. The pizza man totally knows. So that's how they feel. Like people know what I'm thinking or what I'm doing, or anything like that. So they alienate. And also because of what you said, where they don't fit in anywhere, they don't feel like they fit in anywhere, so they're gonna back up. Right? Okay, good. Now, one thing that people fail to realize often is that grief and loss isn't just about death, right? Grief and loss could be you getting married and realizing that you're no longer single, again, not a projection, because I just got married a month ago, and realizing that single life is gone, and this is the person that you'll spend the rest of your life with, and that sort of thing. Or you get laid off of a job, grief and loss, fired, grief and loss, right? So grief and loss is about many different things. I grieved my old car. I had a Mustang. It was badass. Too many miles. I got a new one. I'm like, why did I do this? Not a new Mustang. I went with a Camaro, and people are like, how do you do that? Like, how does that work? Anyway, see, he's even looking at me like, I'm in the closet about it a little bit. So what happens is, how many people have kids here? Children? Okay. So tell me if this resonates. As soon as you find out the sex of the baby, you just plan their entire life. So now, this child who's like, you know, however many weeks in the womb, you've now decided that this child is going to get married in a big, nice church or temple or wherever, and they're going to have this lovely prince or princess that they're going to marry, and they're going to become a doctor, and they're going to have all these fun things. How many people thought that? Don't lie. Thank you for being honest. Right? So I have a child, but he hasn't been born yet. His name is Roman. He's awesome. I think he's going to come out at like age 4. Because that's where I see him with his little red sweater, cardigan, and his little jeans and everything, right? And so I've essentially planned his life already before he was even like conceived. So what happens is that as this child grows up, you have this life that you imagine to be based on your culture, your norms, all of that. And then they turn around and go, yeah, I just want to let you know that I feel like I'm a girl when they're biologically a boy. And it's like, wait a minute, you're my daughter, you're not my son, or vice versa, right? The whole identity changes. Same thing with sexual orientation. You were raised to believe that this is the way that your life should be. And then you come out, or the individual comes out, and now that whole dream has been shattered for the parent, or caregiver and you or the person who's coming out. So now they have to grieve the loss of their heterosexual identity. So what comes with that? Now in California you could get married, which is great. So we don't look at that as much, depending on the religious thing. It's workable. I got married in a Catholic church by a retired Roman Catholic priest, so we were able to make it work. That goes with my values. There's ways to make it work, but when these individuals are grieving that, they don't see it. They see it was supposed to look like this. I was supposed to have children. You could still have children, right? So looking at what they're grieving about their heterosexual identity will help you in treatment so that you can work with those issues, right? So they're going to grieve this for a while. They may accept the LGBT behavior. So maybe this individual starts to, if they're transgender, and they're male, they start wearing women's clothes. But they may still identify as a male, or the individual who gets into a same-sex relationship or is in that relationship or is having sex or whatever with somebody of the same sex, they'll say, I still identify as heterosexual, but I'm engaging in this behavior, right? This is where I say you always want to let them identify. Because if you say, okay, so you're gay. When I deal with individuals who are coming out, they want to know, am I gay? Am I straight? When I say it's a continuum, all this, and I say, don't put yourself in a box. You can identify however you want to identify. It relieves that sort of pressure of, okay, I don't have to put myself in a box yet. I don't have to label myself. It's easy to label yourself because we do that in general, right? I'm a psychologist, I'm a social worker, I'm an MFT. Put them all together in the room, it's a great MMA match. So, they'll probably still identify as heterosexual. Now, in this stage, people may say, it's just this person I'm in love with. This isn't a big, broad spectrum thing. It's just I happen to fall in love with this person. They may say that. Why?
Wonder.
It compartmentalizes it. It's kind of like, okay, because they haven't fully accepted it, they can put it in a little category and it's safe for them.
Yes, it's safe because, oh no, it's just a situation, but maybe after the situation, it wouldn't be like this. It's safe. Somebody said one-hit wonder. Who is that? Excellent. That could be the case, that it just is that person they fell in love with. And that's not truly, they still identify as heterosexual, it's just that one person, right? So interventions in this place is always, again, any stage is to let people identify themselves. This is where you want to start providing education and resources to them. So what I usually say is, because it's kind of like depressed patients. Depressed patients will tell you and think they're the only one in the world going through it, right? Anxiety patients. They're the only ones in the world that have this bad of anxiety, right? What happens here is they say the same thing. They feel like they're the only ones in the world. You can present them with the community and they're like, no, nobody understands what I'm going through. This is me, right? So to link them to resources is really important at this stage because now they can see other people that are going through the same thing as them, right? Encourage them to talk about their losses. So again, continuing to grieve and talk about what they perceive to be a loss. It could be, it couldn't be. It depends. You never know how it's going to turn out. And I'll talk about that in another stage. It's important to link the individual to positive individuals that are supportive, as much support as they can get. Reason being is positive individuals are going to equal positive growth, right? So when I was 18 and I had my first girlfriend, her mom was probably institutionalized back and forth. I don't know what her disorder was. She seemed borderline now looking back in the day, as well as bipolar maybe. On top of that, she was very, very super religious. I can't remember what, but she was very, very super religious. And so I was very religious in my Roman Catholic sort of realm. And so when she started to suspect that something was going on with my girlfriend had a child at the time, a 2-year-old, she called the family meeting, right? And so this little family meeting, I'll never forget this, it's like right there. This little family meeting consisted of Mom, Dad, her, and I. And the mom looked at me and said, if something's going on, it's your fault to me. You did this to my daughter, you're a bad person, and you're going to hell, and you're going to burn. And let me tell you, she just went off. I was 18. So what happened? I didn't come out until 25. Because now I repressed it and said, oh no, I don't know what you're talking about, right? It is my fault. Maybe it is my fault that this happened, but I know it's not my fault, but I feel like it is. And so I internalized all of that. It was very negative, very negative. Things happened with my parents when they suspected, very negative. And so it drew me back to go, maybe I can make this work. And I almost married a man just to like hide it and to please everybody. But that wasn't the answer. So when I came out, I moved out to California and I said I'm out because there's no support. There's nothing out here and I got to deal with this. So positive individuals, positive support, things are a lot better than when I came out and it was in Florida. Florida was really bad, still is. I didn't get a job because they said I was too gay, no joke. They should see me now. Because I was hiding it then. So I was a model, I had long hair, I was a pretty hot tamale. And they were like, yeah, sorry. I was like, wow. And it was legal. Completely legal. Stage 3, identity tolerance. This is where the person is accepting the probability. See, this is where we go from possibility to probability. So they say, gosh, I'm not the only one. What might push somebody from stage 2 to stage 3?
Having that support.
Yes, having the support. What else?
Having a relationship?
Yeah, having a relationship, both of you. Sexual experience.
Others coming out?
Others coming out, good.
Research.
Exposure, right? So that could be why they move forward. So now it's probability. And so now they see that identifying as LGBT or T isn't just about sexuality, right? Because we remember back in the day, most of us will remember when they used to say, and they still say it, I don't care what they do in the bedroom, just don't let me know. Everything was about sex. They didn't see them as a whole person. So here they start seeing the different aspects of sexual. It's sexual, it's emotional, it's physical, it's spiritual. There's so many different components to it. They see that versus just the sex. Okay? So, what do? We want to start working with them even more about decreasing that isolation that they're experiencing, that isolation of pulling back from people. We want them really to get paired up, meet LGBT people, like pushing it forward, immersing them, and explore the shame surrounding internalized homophobia and heterosexism. So what is internalized homophobia?
You're embarrassed about yourself.
Yeah, embarrassed about yourself, self-hatred.
Yes, something.
Right? So everybody experiences that to an extent, anybody, right? So for an LGBT or LGBT person, depending on how they identify, I know female to male individuals who are they consider themselves or identify as gay men now, right? So depending on the spectrum there, but here everybody sort of experiences this in one way or another. And heterosexism. What's heterosexism? It's the assumption that everybody's heterosexual. So I always use the one term, or the one thing. If you pay attention to it, you'll see it every day. I promise you. You'll see it every day. So this could be, I call up a real estate agent and I say, hi, I'm looking for a house. We are going to relocate, and so could you help me? Oh, okay, what's your husband do? Right? That's number one. You'll see it. Two, I always use this one. Women, bring your men down to mattress discounters. Right? Try out the mattresses in an appropriate manner. They don't say that piece, but so you've just excluded a whole bunch of people. Am I going to mattress discounters? No. Or if I go in, am I going to feel uncomfortable? Yes. So this happens all the time. I hear it on the radio all the time. Right? So that's the assumption. Okay. So stage 4 is identity acceptance, and the person says, I'm going to be okay. Now, somebody, again, always find out how they identify, because even though they accept it, doesn't mean that they will let go of holding on to their heterosexual identity, okay? So here, what they may do, they go from possibility to probability to accept versus tolerate it, okay? So now they're accepting it. They will start increasing their contact with the LGBT community, maybe going to gay bars or gay events, and they start really incorporating themselves into the community because that's where they're receiving the support. And now they feel like these are my people, right? What happens here, because we feel like it's the fairy tale ending coming soon where it's going to be like, everything's okay, yay, right? Not always. And this is why. Because people in this stage will now start pulling themselves out of and isolating from the heterosexual community. Okay? So they're saying, I don't fit in there anymore, so I need to hang out with my people, right? Which you'll see can get rough. Here, they will become selective in who they tell. This is important when you're helping as a clinician or somebody, even if a family relative, whatever, to come out. The first thing I do with them is I explore who are they going to tell, why are they telling, okay? So some people will say, oh, okay, so let's take somebody who says, all right, I'll say, who do you think is going to be the coolest? Grandpa Joe. All right. Grandpa Joe has a lot of gay friends. Okay. So what do you think his response will be? I think he'll hold me in his arms, and it's like the Oprah show, and, you know, tell me everything's going to be okay, and, like, he still loves me. Okay. So that's Grandpa Joe. Now, what is the worst possibility with Grandpa Joe? Oh, when he gets pissed, he gets pissed. Okay? So what might that look like? He may tell me to leave. He may tell me that, you know, this, that, and the other, and all these negative things. Okay. Why do I do that if he says that, he or she says that Grandpa Joe's cool?
Because it might not be that way.
Yeah, he might not be that way. Grandpa Joe might not be cool. Just because he has gay friends, that's not his blood. And that's how sometimes that happens, right? So you always want to explore what's the positives, what's the negatives. And I say to them, we cannot expect things to happen the way we do in our head. We do that often. If you've ever been like, oh, I'm going to go tell so-and-so this, that, and the other, and I'm going to tell her or him, da-da-da-da-da, and then you go up and you're like, hi, I just wanted to talk. You know, it never comes out that way. So that's how it happens, right? And so this is where I also tell them, okay, you can give them the information, but once you let that go, it's their issue. It's not about you. It's not about anything. You can't take on their anxiety or anger or whatever. Now, does this mean that it's okay for the person to get abused or get screamed at or whatever? No, that's because you're going to teach them coping skills. So when that person, if Grandpa Joe goes off on him, okay, what are you going to do in that moment? I also assist them with where they're going to tell him. So I'm going to take Grandpa Joe out to Mastro's or to P.F. Chang's or something. Okay, so if Grandpa Joe blows up at P.F. Chang's, do you really want to be there, right? Sometimes I tell them, all right, you want to go to their house because then you can leave. Do you want it to be at your house because that's your territory? Like, what works for you? Right? And so I also tell, I'm not saying that it's going to turn out any way, but we want to always prepare. Because the people who you think are going to be the coolest might not be, and the people who you think are going to be the roughest may turn to you and go, I always knew. I was just waiting. Or, they're cool. Right? Again, continue to talk about the losses of their heterosexual identity. Talk about internalized homophobia and heterosexism. Talk about, and when you work with the grief, again, it's not focusing on the losses and being like, remember how you're dealing with, this loss. Like, so how are you, instead of that, you would say, how are you doing with processing sort of these things that we talked about before, right? I talked about assisting when, where, and how, and who they tell. Because say they're in a position like, I used to use the military as an example, I still use the military example, even though they're cool, supposedly, it's still a transition, right? So why do you think you need to tell your captain or whoever? Why do you think that's important? And the reason why I ask that is because sometimes it may not be safe or it could affect them. I'm not encouraging them to stay in the closet. I'm encouraging them to think about the outcomes that can happen due to them coming out. So tell me a little bit what may happen. Oh, I could lose my this, that, I'm supposed to get out in 2 months. Okay, do you really want to jeopardize having a dishonorable discharge? Because if you jeopardize yourself, this could happen. So do you want to wait a couple months? Like, why do you feel the need? And oftentimes they feel the need because identity pride, stage 5, is I've got to tell the world who I am. Right? Now, many people would ask me, why do they have to put rainbows on their car? Why do they have to put, wear t-shirts that say I'm gay but my boyfriend isn't? Like, or I'm not gay but my boyfriend is, things like that. And I'm like, okay, so think about your culture. I'm Italian, Roman Catholic. In my vehicle, I have a cross that hangs on my dashboard. That's my pride in my religion. I have tons of Italian flags. I try to keep them down, but, because it's like overkill. And that's my pride, right? How many other people have that with their, maybe their heritage, where you have flags or you buy things, right? So you get proud. Epcot in Orlando, has anybody been there to Epcot? Yeah, they have where you can go to the different little countries, right? And so it's like, yeah, I'm going to hit up Italy, look for Italy stuff, or people may go to the Polish area or German or whatever, because they're going to a place where they're like, these are my people. And that's what happens here. They get very prideful. They want to show everybody, like, I found out who I am. Right? And so this is where you might see that. The problem is in this stage, because this is where we're like, oh, good, they're like where they need to be, but not yet. Because many people will engulf themselves in the community, and now it becomes heterosexuals are bad, our community is good. You did this to us. This is why we live in a big gay bubble. because you did this to us. So when I was in stage 5, I ran the LGBT Youth Center in San Diego. I lived in Hillcrest because that's the big gay area of San Diego. So I lived in Hillcrest. I worked for the center in Hillcrest. I partied in Hillcrest. My friends were in Hillcrest and they were all gay. And then I left my big gay bubble to go to school, in which I was very, with the professors, I was like, that's heterosexist, you know? Because I needed to educate them and be like, you know, what you're saying right now, what about in couples therapy, when I took that class, I was like, what about same-sex couples? Like, are you going to address that? Yeah, no. Right? And it's like, wow. So, you become engulfed, the individuals become engulfed in this. And so, now again, heterosexuals are bad. This is reverse discrimination that happens, right? There's names for heterosexual individuals like breeders and things like that, just so you know. So, what do you do in this stage? You explore the us versus them mentality. Because what happens if they get fired from their job that's in Hillcrest and now they have to find another one that's out of their big gay bubble? What's going to happen?
Culture shock.
Yes. Now the anxiety, they may go back a stage. And like, I'm not coming out to anybody, I don't want them to know. Let me take all my gay stuff off my resume, that kind of thing. I did that. And when I was applying to the gay community center, I took off all my work with the Catholic Church because I thought they were going to judge me. So people will do that as a safety, like when it comes. So now they may go back a couple stages, and now they're in the closet again when they were very open, right? So looking at the us versus them, continuing to explore coping skills to address the heterosexism, the internalized homophobia, all of that, because it's going to last forever. There's always somebody that they're going to have to come out to, or that they're going to have to address. Or I remember last year going to my GI doctor, and it was a new visit, and she's like, so I fill out the forms, and it's like single, married, whatever, and then she looks at me, and she's like, can I ask you a question? I'm like, here it comes. And she's like, are you gay? And I'm like, yes. And I'm thinking, why the hell did you need to know that? Now, I'm stage 6, I'm open, you know, whatever, but I felt discomfort in that moment. Like, why do you need to know this? What is this about? And being a psychologist on top of it, I'm completely ripping her apart in my head. And I'm like, why would my GI stuff affect this? Because I have Crohn's disease. So I'm like, you didn't ask me if I was Jewish. And Jewish individuals, they tend to know to have GI distress, Crohn's disease, all that stuff, but you'll ask me if I'm gay. Like, that doesn't make sense to me. So, it wasn't about me, it was about her. So I stopped going to her because she was weird anyway. Stage 6, identity synthesis. So here, I am more than just LGBT, because what happens when I teach cultural diversity, I have people make a graph, and I also have them make a recipe. So if I was going to make you, tell me what that recipe would look like. So you may say, you know, like 2 teaspoons of this, or a tablespoon, or a cup of this, and kind of graph it out as well and make that list, because this helps people understand, who are you, right? And so in stage 5, what happens is that recipe becomes 100% gay, or lesbian, or bisexual, or transgender. Like, that's who I am. Here, they come back and they go, okay, yeah, I'm an artist, I'm a psychologist, I'm Jewish, I'm, you know, a basketball player, I'm this. And maybe 5%, that little sliver, is them identifying as LGBT or T. So they go from that sort of rigid, this is who I am. It's not like, oh, hi, I'm Dr. DeFeo. It's like, hey, I'm gay. Nice to meet you, you know? 2, now they encompass this holistic view of themselves, and that's important. So what are we going to do in this stage? We're going to continue to address heterosexism, internalized homophobia. They tend to decrease their anger here, and they'll start hanging out in non-gay establishments. They will start to make heterosexual friends, and they just become in the world, right? So it doesn't matter where they work, where they live, they just go anywhere, and they just live their life, and that's really healthy. I know a lot of people who are still in stage 5, and they will not leave, and that's their safety net. They're going to stay in the gay community, they're going to work there, they're going to hang out there, they're going to have all gay friends, and that's what's comfortable to them. The reality is eventually they may have to leave that. And what is that going to look like? Now, people can go from stage 1 and 2 to stage 6. They could skip stages, they could go back, right? It might not necessarily happen in that order. So, I want to talk about the couples issue. So one thing you want to remember is if you ever get a couple that comes into treatment and they say, yeah, we're a same-sex couple, we're coming in because we've been having arguments and we kind of just want to, talk about that, and you're not going to go right into the fact that they're a same-sex couple, because same-sex couples have the same issues as heterosexual couples that come in. Like, you wouldn't have a heterosexual couple come in and go, okay, so tell me about your heterosexual life, and like that sort of thing, right? What happens though is there's a lot of pressures that they may not see that impact the relationship because they are a same-sex couple, okay? So that may be you exploring that internally and then throwing it out there. When I used to do inter-partner domestic violence, there's a lot of research that shows that there's a lot of domestic violence within the LGBT couples because of the fact of these societal pressures. Also, if you think about it, if you have a man and a woman, which we see a lot, domestic violence, that's what we've always known it as, and the girl hits the guy, what happens? Sometimes it's like, well, you just leave them alone. Like, even for men, it's hard because they will get the shit beat out of them by a woman, and it's like, I can't call, I can't let them know this, right? Because then how am I going to be seen? Same, now when you look at two men fighting is usually okay, right? Two women fighting is actually funny sometimes. I'm gonna punch you, but you see women in MMA now, those girls are brutal, man. So two girls fighting is usually okay. It's like, oh, it's a cat fight type thing.
What's MMA?
Oh, mixed martial arts. So like UFC, Ultimate Fighting, you should check it out. There's a big octagon and they fight in it. So what may play into it is things like stage differences. So if you have somebody, let's say in stage 2, they're still figuring things out, and you have and the couple's together, and one's in stage 6. What issues do you think they may present with?
One is fine being in public as a couple and the other's not.
Yes. So one's like, why can't you hold my hand? And the other one's really dealing with internalized homophobia, right? That plays into intimacy in the relationship. What else?
Going to certain places.
Yes, going to certain places. So maybe on one, mom and dad don't know, or their caregiver, because they haven't told them and they're not feeling safe. The other one's like, well, if you loved me and you were proud of me, you would take me. That's pushing that person, which is not good. So they could be fighting about that. What else?
Friends, trust.
Friends, trust.
One family being supportive, like one side of parents being supportive, and the other ones aren't at all.
Yes. So they can go to one house for Christmas or whatever they celebrate, but they can't go to the other one. And now sometimes they have to split because they have to go, but they can't go to one and then the other, or how people work it out. What else?
Jealousy?
Yes. So you have somebody that's still, this is a big thing in the community. You have somebody who's still figuring their stuff out. You have somebody who figured out their identity and they're like distrustful towards that person because they're like, all right, now they could hook up with men or women. So they can't have any friends oftentimes because it's like, all right, what are you doing? It's kind of like if you think, and many a times they'll use this as a way to explain it, but they'll say, all right, imagine a married couple, heterosexual couple, and the male goes on a vacation or like a friendship type thing to Vegas or wherever they go, and they're going to share a room. The wife would be like, hell no, right? So that happens, but it can happen with both. So you're not going away with that guy. You're not going away with that girl and sleeping in the same room. There's a lot of jealousy that can happen. What else?
Like a parenting kind of figure, almost.
How so?
The stage 6, trying to guide the stage 2, and that can not be good.
Yes, good. So they may turn into a parent or
Therapist.
a therapist, yeah. And they're helping them work through that. Not good. That's too much pressure. What else?
Age.
Who said age? Good. So, we have age differences in many couples in general, right? And so, many people say age doesn't matter. Many people say it does matter because one's at one developmental, and where is it okay? Like, if you're 18 and you're dating a 9-year-old, no bueno. But if you're, 40 and dating a 49-year-old, little different, right? Age can definitely play into that because what happens is there's a term that we'll use, which is delayed adolescence. And what that means is when somebody goes through adolescence, and this happens, maybe they come out in their 20s, they go through adolescence, they explore all those things and whatnot. They get into their 20s, they now come out. They essentially may go through adolescence again. Because now it's like, ooh, now I'm going to go around and date all these women or men and this, that, and the other. And so we call it a delayed adolescence. Sometimes they don't, if they are coming out at a younger age, say, 13, 14, they might not go through the same things because they're backing off because they want to hold off until they figure out who they're going to be with. And so that could delay it as well. So you may have somebody developmentally that's in a different, depending on age, that's been there, done that, and is like, I'm not going through this again, based on age as well, right? You have somebody who's in their 30s, and then you have somebody who's in their 40s. The 40-year-old's like, I don't have time for this shit. Like, I want to settle down, I want to have kids, I want to do this, and the 30-year-old's going, I got things to explore. So that is very good to age. Other stuff, other presentations. With the different stages and one parent or one set of friends and parents being cool, the other one's not, there's a lot of rejection that can be experienced on both parts. So we're looking at that. Depression, anxiety. Gender roles is another big one. So oftentimes I've heard, and even to this day, they're like, oh, they say to me, oh, you're totally the dude in the relationship. And it's like, actually, kind of really emotional. So, I think I cry more than my partner. But, and she's a typical feminine woman who you wouldn't be able to tell at all, right? Me, it's kind of obvious. So with her, so then society will say, okay, well, they'll put us in that traditional role, right? So it's actually really funny because I keep track in my head now that I've realized it, that when we go out to a restaurant, I always get the bill. I'm like, this is so not cool. Like, and we laugh now because we'll wait and watch, and they always slip it right by me, and I'm like, that's kind of messed up, right? So I get stuck paying the bill. And there's some that'll drop it right in the middle, that's what you're supposed to do, but it always comes towards me, that bill, right? So if anybody wants free lunch, just come to lunch with me. Now, I almost wore the same outfit that you're wearing today, the black, the purple, and the purple, right? So if we went out like that, they'd probably be like, I don't know.
2 separate checks.
Yeah, exactly. Yeah, they would say, do you want separate checks? I'd be like, no, that's my husband. So, gender roles can create a lot of pressure, right? Because society will put it, and so automatically, individuals start picking up those roles and trying to say, all right, you're the one who cleans, I pay the bills, whatever it may be. That couple may experience that. And that could be pressure. That could be a lot of pressure. We see that in heterosexual couples where they're like, okay, you're supposed to be in the kitchen, barefoot, pregnant, you know, all that, and the guy's supposed to go out. And when we see the opposite, except for the male pregnant, but home taking care of the kids and all that, and the women out working, people are like, that's just wrong. So it happens that way as well. Legal financial pressures, right? There's this big joke. If you have a gay marriage between 2 men, you're going to leave there with like $7,000 each as your gift. And if you leave a lesbian wedding, you're probably going to have like a dog collar or something, right? So men tend to make, and we know this, make more money than women. So 2 men in a relationship, this is why gay men, like, I would always say, why do gay men always have so much money? Like, they're like well off. And it's because you have 2 people in powerful, usually, positions making a lot of money. Whereas 2 women, it's like less. So legal financial, which financial stuff really plays into any relationship. It's like one of the reasons why people divorce over money or people fight over money, couples. Legal stuff. So if you're not protected, like California's protected now, but before gay marriage passed, out of, I think there was like 1,800 rights that come with getting married as a heterosexual couple. I think the gay community, like if you're a domestic partner, it was only like 20 or something that you get. So you're thinking about hospital stuff. So one's in the hospital, and you come up and you say, yeah, that's my girlfriend, and they say, we're only letting family in. Now you've separated them. It happens. It happened to me on multiple occasions. Or now you can go, yeah, we're married. Now if a heterosexual couple did that, they wouldn't question it. But now we have to carry papers on us just in case they say, well, show me the paperwork. Like, that's messed up. Because, you know. So the legal, financial, religious discrimination can play on the couple. I can't tell you how many people come to me because on my website I have that I treat and work with religious issues, and that I'm Roman Catholic and I still embrace that. People come to me, can you help me? Because I'm dealing with my sexuality and I am Catholic and I want to know how I can work through this. So religious things, some people get kicked out of their church or temple or wherever they practice their religion, internalized homophobia, outness, family support. Now, here's the big piece. So you have a same-sex couple, but now you add on biracial relationship to that. That extends it so hard because you're dealing with a biracial, gay or lesbian or same-sex relationship. Now you have race, you have sexual orientation. These are a whole nother set of factors that come with it because they're pretty much dating twice, right? Still the case, like you see biracial relationships. I have a friend who is white. She married a black man. He does identify that way. Okay. Just to be clear, for those of you who weren't here earlier, it won't make sense why I'm saying that. And when they first started dating, she's like, Jen, I totally get what you go through. And I'm like, why? And she's like, I'm walking down the street holding his hand, and people are looking at us like, really? Like, you two are together? Like, one's black, one's white? Right? This still exists. But people don't pay attention to it. They don't see it. They think, oh yeah, it's fine, everything's okay now. No, it's not. So now you have internalized racism, internalized homophobia on top of that, going into this biracial relationship. Very difficult. I was in a relationship for several years with somebody who was Iranian. Very difficult. Very difficult. Mom thought we should be in a psychiatric hospital. Then she fell in love with me because I washed her car.
That was easy.
Exactly. And so when we actually separated, her mom was like, "You're an idiot," to my ex-partner. "You screwed this up. That's why she left." You know, I was like, "Yeah, Mom." So, but there was a lot of things that, you know, I couldn't go to Iran with her if she went or when she went, because we would be fearful of what would happen, and I wanted to go. So there's a lot of things that play into multiracial, biracial, and LGBT identification. So we have about 6 minutes left. So I wanted to ask, does anybody have any questions? Yes?
Is it okay to bring up a particular case?
Yeah, go for it.
Okay, I've got a young Persian girl, 17. She's kind of in that, she's at the very beginning of the process, trying to decide, she's only 17. So I get the brilliant idea, because she has a total family, well, perhaps her dad could come in by himself. And I know not to call the mother, because I know the mother is very hysterical. So the dad comes in and I say, he says, I'm not going to tell the mother yet. Of course I won't break confidentiality, and of course he does. The mother's now calling me and saying, blah, 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 because I can barely understand her. But what I get from the daughter is, she's saying that she's hoping that I can get the demons out of her. And if she goes to therapy twice a week, now I'm Roman Catholic also. If she goes to therapy twice a week, then I can work with the demons. She's called me and asked me if she could. And I'm kind of needing some advice now that I've already done some stuff. But I don't know which, and I've got the daughter's permission, but I told her it's still going to be my decision.
Right.
Because she is only 17.
Are they Baha'i?
No, they're kind of, they're not really practicing Muslim,
Okay.
but that's their heritage.
Okay. So there's multiple ways you can go with that. The first thing is if you could find somebody, and I know they're out there, that are in the Muslim community that are supportive, like a religious figure or something, because there are, to maybe link them. Mom's gonna push away a lot. And so my thing with her would be, I understand that from your religious standpoint that you believe that she's possessed, essentially. And so I'm wondering how you think I can help you.
So would I have her come in by herself then, or have her come in only with the daughter?
If you can talk to her alone, that would be good. If the daughter's 17, so mom consented. So I would maybe bring in both mom and dad. Because now you're essentially splitting them. Since dad already told mom, bring them in together and kind of have a conversation about it. And hopefully dad sounds like he's cool. Is he dealing with
Sort
it?
of, but he's kind of flipped over.
Yeah. So, and they're gonna play on each other. So he could be an in to help mom. So I would process, what do you believe's going on with your daughter from a religious standpoint, from a cultural standpoint, from your own viewpoints, and what do you think it is I can do to help? Because I've had people who've come to me and said, I want you to make me not gay. And I'm like, and they came to the LGBT center. And I'm like, yeah, so I can't do that, but what I can do is I can process why you feel like you need to go, want me to make you not gay, right? So essentially you need more information. I would go there. There's also support groups such as PFLAG, Parents, Families of Lesbian and Gays, that they're stage 1. This brings up a good point. So somebody goes through the stages, finally they're telling other people, and now what happens is that families, friends, all of that have to follow through those stages as well. Is it okay to abuse them, to kick them out of the house, to put them in unsafe situations? Absolutely not. But do we need to be understanding that now the parent or caregiver is going to go, could my kid be gay? Okay, it's possible. All right, it's probable. Okay, I'm going to accept this. So they kind of have to go through those stages too. So if she's like stage 0, pretty much, right, mom?
Minus.
Yeah, exactly, negative. So with her, if you link her to resources, she's probably gonna push back. So really it's about processing. I would do some grief and loss work with them, like what's it mean that your child is identifying this way? And how does your sort of the way that you are addressing this impact your child? But if they truly think she's possessed, it's going to be very difficult. Yes?
Something Max just said that regarding Iranian.
Sure.
I'm Iranian.
Okay.
If we can ask if there are two kinds of Iranians, different religion, but if they are Muslim, there are some totally don't practice.
Yeah.
But the culturally, that's embarrassing to them.
Yes.
They don't even. They are easier or lesbian because they are girls, it's okay, they can go, but boys absolutely.
Yes.
So that point is, that's important, because if they are religious, like me, my son told me that once he was in the mosque, 17-year-old raised his hand and asked their mom, like a priest, so what is it, what Islam say about homosexuality? They shut him up right away. Don't talk about that, we want to have da. And my son's friend raised his hand and said, answer him. He's asking you, just answer him. So I took that, and we were very upset about that. I went to a seminar in San Jose, somebody that really practices Islam, and he's very open-minded. And I asked him, I said, can you believe that a mom in that mosque says such a thing? So what do you say? I trust you, you're educated, you live in America a whole lot. You're not. If somebody asks you, what do you say that? He says there are so many issues. And sure enough, in the session that they have that night, somebody, a young man, said, what do you think about homosexuality and Islam? He answered very nicely. He said, I know in Islam said homosexuality is forbidden, but before anything, we have to consider that they are human beings.
Yes.
And there are a lot of research needs to be done in regard to that. I love him for that because he's also psychologist. He said, we don't have resources to put them down. Even the Islam said that. So as far as the religious concern, if you go to somebody idiot like that, a mom that I don't respect them, they will say that. But somebody like him, they will say that. But I'm thinking, if they don't practice like the baby do, or they are so much practice, it's culture.
Yes.
That if somebody say, oh, you're young, get married, oh no, you have a partner, that's the one that can talk. And I don't know if you want, I can.
Well, this is transgender, I forgot to say that part.
Oh.
Yes, I thought yeah.
Okay,
So they don't wanna have a boy, they choose the girl.
Okay, then I can have something like that about that. You know, in Iran, the Ayatollah Khomeini, one thing he did, which is, I mean, kind of hard to believe, he allowed free surgery for these people that they have to use one sex. Nobody believed that. $50,000 worth of surgery, this is what, pick one gender. You can't be both.
Right.
So, gay people, I went to Iran and I saw it, they allow them to do that, they pay for free, help them, and they have seminars, things like that. And that's a very, very issue, they don't want to accept it, it's very difficult to accept that. But I've seen that it happens.
Yeah.
God,
Maybe you guys can connect after, because it sounds like you have a lot of really good resources and stuff. That's a tough issue. That's a really tough issue. So maybe you guys can chat. Merci. Other questions before we end?
can I say something?
Sure.
My son's best friend, and I know him for 18 years, he came to US, he's from Lebanon, he's Muslim practicing Islam. Got married, he's in Nigeria, and they had 3 children, and 3 years ago, he said, I want to become a woman. My son prepared me, he said, Mom, you're going to be shocked or something is going wrong, he's getting weird. I said, what? He said, for a week I wasn't thinking, how did I not pick it up as a even clinician? But then, to me, it doesn't matter. I mean, I love him the same, but I have hard time sometimes. I say, you are son to me, I don't know if they're calling daughter or son. I have always that problem. He went 2 years on all the hormonal therapy with it. His wife accepted. 3 smart, beautiful kids. But now, the wife is just rejecting, get out of the house, I don't love you, I this and that, and doesn't allow him to see the kids. The family in Lebanon totally rejected, totally. Now he's out, he's been in therapy for 3 years. He called me last week and he said, I'm going back to Lebanon, and then I'm just going to leave everything. She doesn't let me see the kids. And I was a good father to them. But if I asked, how are you going to go to Lebanon? He said, then I'm going to go to the Persian Gulf, one of the area to work and make money. I said, what? He says, I have to become a man again. So I saw him, I said, with the hormone you have, you're totally woman, you're going to just reject your identity. You worked so many years with that. Again, he says, called me Mom. He says, Mom, I went and I bought boys' clothes and I was crying and crying.
Oh,
So
so
I don't know
sad.
how to help him.
Let's talk after. I'll talk to you after, because I know we're going a little bit over, and I know people have to go. But Natasha has my information. If you have any questions, it's really easy. DeFeo at thechicago.school.edu, but she can tell you the right spelling and all that fun stuff. And it was a pleasure to be here. And if you have any questions or anything, please feel free to contact me. Okay?
Thank you.